My name is Kelsey Niemeyer,
My name is Carly Amodio.
and we're performing low-flow oxygen therapy by simple oxygen mask at 8 liters per minute.
The patient's name is Kelsey Niemeyer. Her date of birth is 1/13/1995. The date of arrival is 10/12/16, and her attending physician is Dr. Robert Flo, room 1028, bed 2. Kelsey is a 5'3", 21-year-old female who was admitted to the emergency department on 10/12/16 at 08:16 when she walked in feeling fatigued, short of breath, lightheaded, dizzy, weak, and has palpitations. The patient stated that she has not been feeling well the past few days and finally felt worse enough to come to the hospital. Ms. Niemeyer has been to the hospital before for multiple blood transfusions for anemia. The emergency department nurse took her vitals and Dr. Flo ordered an ABG and a CBC. The patient complains of tiredness, shortness of breath, lightheaded, dizzy, weak, and palpitations. Her medications include iron supplements and vitamin B. She has no known allergies. Kelsey is not a smoker and does not use smokeless tobacco, only drinks alcohol occasionally, and has no previous medication abuse or use related to anemia. Patient complains of dyspnea, shortness of breath on exertion, orthopnea, denies cough, and denies sputum production. No previous respiratory infections. As for her cardiovascular, the patient denies angina and TIAs. Patient complains of dizziness, orthopnea, palpitations, and has a low blood pressure. Her gastrointestinal was no constipation, diarrhea, and hepatitis. Patient complains of some nausea from feeling weak and has a change in stool color. The patient also complains of intolerance to the cold, history of anemia, excessive bruising, and bleeding. The patient has a history of syncope, headaches, weakness, dizziness, and vertigo. The nurse took her vitals and they came back as follows. Her blood pressure was 90/66. Her heart rate is 134 beats per minute. Her respiratory rate is 26 breaths per minute. Her temperature was 37.1 degrees Celsius, and her SpO2 was 89%. In general, Kelsey is a 21-year-old female who appears short of breath with worsening symptoms, adequate nourishment, and hydration. Patient is alert, cooperative, and appears to be in acute distress, but not in a serious condition. Her skin is pale and cold to touch, slight cyanosis, no abrasions or cuts, but some bruising. Texture and turgor is normal. Her head appears to be symmetrical with no deformities and is atraumatic. Her nose has no septal deviation but possible nose flaring. Her teeth are in good condition. Gums are pink with no bleeding and no swelling. Her neck has equal carotid pulses and no tracheal deviation, no JVD. Her lungs are clear bilaterally, moderately labored, although has a normal pattern, symmetrical chest expansion, and the patient is tachypnic. Patient had no heart murmurs, skips, or abnormal heart sounds, but she was tachycardic. Her abdomen was flat and soft, non-tender, no masses or orgonomically. Spleen and liver have no inflammation when palpated. Her extremities show no signs of clubbing, but slight cyanosis, no edema, fingernail beds appear flail. The patient is an oriented person, place, and time neurologically. The results came back as followed. For her CBC, her red blood cells were 3.7, which is low. The normal would be 4.2 to 5.4. Her white blood cell count was 7,000, which is normal. Her hemoglobin levels were 8 grams per liter, which is low. Normal would be 12 to 14. Her hemocrat was 24%. For her ABGs, the patient was uncompensated acute respiratory alkalosis with moderate hypoxemia. Her pH was 7.51, which is high alkalytic. The normal is 7.35 to 7.45. Her PaO2 was 55, which is also low. The normal would be 80 to 100. are tidal volume, respiratory rate, flow, and fit. Some disadvantages of the simple oxygen mask would be that they interfere with eating and drinking. They must be removed for facial and dental care. Aspiration, claustrophobia, skin irritation, and O2 concentrations vary. Some advantages of simple oxygen masks are that they are very easy to use, provide higher oxygen concentration than a nasal cannula, and there is less dryness with a simple mask than there is with nasal cannula at the same flow. Some favorable signs of low flow oxygen use are slowing of the pulse rate and the breathing rate to a more normal level, elimination of chest pain, improvement in skin color, decrease in anxiety level and restlessness, relief of dyspnea, and increase in mental acuity. Unfavorable signs are sleepiness, increasing hypoventilation, patient complaining of headache, no improvement in unfavorable clinical signs observed prior to oxygen administration, and adverse vital sign changes. Flows greater than 4 liters per minute require a bubble humidifier, while a simple oxygen mask requires a bubble humidifier due to flows being 5 or greater. One is not indicated in acute care situations. Hi, my name is Carly. I'm a student at the MVCC Respiratory Care Program, and I'm here to deliver the oxygen therapy that your doctor prescribed for you.
Okay.
Can you just let me know your name and date of birth, please?
Kelsey Niemeyer, 11395.
Okay, thank you.
Why am I receiving this therapy?
So you had blood work done when you got here, and it revealed that you had low levels of oxygen in your blood. So the therapy is just going to help bring your oxygen back to normal levels, and it will decrease your work of breathing so you don't feel that shortness of breath, and it'll bring down your rate.
Okay.
Just going to take your vitals first. Just hold your hand, please.
What does this do?
This just reads the amount of oxygen in your blood. I'm just going to take your pulse.
Yeah, I think they're using one of them now, right? They're using the pulse ox, right? I'm not sure if any other ones are.
So your heart rate was 134 beats per minute, so it's slightly high. And your oxygen is at 89%, so it's a little bit low. The normal is usually between 90 to 100%.
Okay.
So now I'm just going to take your breath sounds. I'm just going to have you look away and take deep breaths. Just face that way.
Your heart rate goes down. Oh, like clarity increases. Okay, exactly, I know that you were often will be affected.
clear, so that's good. So your doctor prescribed 45% oxygen. Usually in normal room air, you'd be breathing 21% oxygen, so it should definitely help with your shortness of breath.
What can you guys do about me feeling really dizzy and my headaches?
So the oxygen therapy should help that, but if your headache persists or gets any worse, just let us know and we can modify that for you.
Okay. Should I just put this on my face?
Yep. And you can put the strap right on the back of your head.
Take the glasses off. Like that?
And then you could just bend that piece so it just molds to your face.
What is that you're doing?
This is a bubble humidifier, so it's going to moisten the oxygen that's being delivered to you so that it doesn't dry out your airways.
Okay. What is that in there?
Sterile water.
Okay. How am I going to eat and drink with this thing on?
Whenever you get hungry or thirsty, you can just let me know and I'll take it off for you, and I could hook you up to a nasal cannula while you're eating and drinking, and then we'll just put the simple mask back on.
Okay.
So this is the nasal cannula that I was telling you about for when you were eating and drinking. You're just going to leave this right here, and whenever you want to eat or drink, just let me know and I can plug you up to that one.
Okay.
So I'm just going to take your vitals again and see how the oxygen therapy is working.
We got one on the table, that gets me up, but I just don't bring that. But on our sheet, it says, that gives me up, but that I'll be so longer being that.
Well, all I know is like for the machine, you know, the air training that right there.
Yeah.
If you put it on a 35% air training, it's going to stay 35, no matter what the patient does.
So the ID's no longer being met.
So you're talking about like what happens to the patient?
That's literally all the time.
Yeah, it's gonna go down. Like he's gonna breathe in. He's breathing faster, right?
Yeah.
So he's gonna breathe in more room air. So the patients.
Yeah, see, that's what I was thinking, but like, aren't they basically asking what we do with the oxygen and wouldn't she want to increase that? Or it's like, they're not asking that. Yeah, it would make sense that it would decrease. You understand, Anna? That it would decrease?
It's kind of like the
I
air training.
hyperventilation.
You get more air inside, so less oxygen. It's like when
Well, you want to think about hyperventilation, increased CO2, taking out some of the radio. Is that on there?
I mean, if you have vacuum control, well, then your oxygen percentage may decrease.
So your heart rate already went down a little bit, and your oxygen percent went up, so it's looking like it's working. Are you feeling any better?
Yeah, a little bit.
Okay, great.
I feel a lot less dizzy.
That's awesome. How's your headache?
Oh, it's still there.
Okay. Now.
I feel like a little bit way better.
Just gonna have you look back in, take some deep breaths.
Not like giving treatments and stuff.
Wow. 뭐 동영상 미디어. 우리나라 한개
This neck must be immobilized until he is back to Therefore, we are unable to see his neck. As long as the cervical collar is in place. Have no other
You just buy the shirt. You have to get it
And your
all.
breath signs sound good, so that's
Or
nice.
along
Okay.
the
Do you have any other questions?
Are there any side effects to
Or
this?
like overall.
Some people do say that they feel a little bit sleepy. Some people also say they get headaches, so it's not normal that you have one right now. If it gets any worse, just let us know and then we can modify the therapy for you.
Okay.
Okay?
Thank you.
They, they
If you have any other questions, just let me know.
Okay, thank you.
The plan of care was to start the patient off on a simple oxygen mask at 8 liters per minute to give patient an estimated FiO2 of 0.45 with bubble humidifier, to titrate and wean to maintain an SpO2 of greater than 92. The physician modified the order to add a nasal cannula at 6 liters per minute for eating and drinking. On 10/12/16 at 3 o'clock, the patient received a treatment of a simple oxygen mask at 8 liters per minute. The patient tolerated very well and vitals improved. Pre-vitals were blood pressure 90/66, heart rate 134 beats per minute, respiratory rate 26 breaths per minute, and SpO2 of 89%. The post-vitals were 115/90, heart rate was 94, respiratory rate was 18 breaths per minute, and the SpO2 was 93%. Breath sounds were diminished, improved aeration after oxygen therapy.